when we look at prostate cancer terms that come up, we hear about the PSA test, we hear about free PSA. Is free PSA different from PSA? And also, what is it?
Free PSA was an early test developed to help guide doctors as to who needs to do a biopsy and who merely has a high PSA because they have an enlarged prostate. And free PSA was one of the earliest tests available for this. And it's kind of like a poor man's ultrasound. We always advise people who have an elevated PSA to get an imaging study, get an ultrasound, get an MRI, determine how big the prostate is so that you know the PSA density. That is the ratio between the PSA and the size of the gland. Men that have bigger prostates can run higher PSAs, and it doesn't have to be from cancer. So the free PSA is kind of like a poor man's ultrasound. The percentage gives some sense of whether the PSA elevation is coming from a big prostate or whether the elevation is unrelated to a big prostate, and then perhaps more likely due to either prostatitis or prostate cancer. I don't use free PSA anymore because there are newer, better tests, and we do typically get imaging in most everybody with a high PSA. So it's in its heyday, it was provided a little bit of insight as to the cause of an elevated PSA, but these days I really don't see any purpose in doing free PSA.
So what would the free PSA numbers look like compared to a normal PSA result? Would it be higher, lower numbers?
So free PSA is also, like some of the other tests, reported out as a percentage. And the prostate being enlarged, in other words, the PSA being elevated because of a benign cause, is indicated in men that have free PSA levels greater than 10%. So in men that have a free PSA that's less than 10%, and they report a total PSA, and then they say what percentage of that total is free, and that's a percentage. So when the free PSA is less than 10%, that suggests that the elevation of PSA doesn't come from prostate enlargement, and that maybe this individual's PSA, who happens to have an elevated PSA, is due to either prostate cancer or prostatitis. That 10% figure is what I use for discriminating when someone has an unfavorable free PSA, less than 10%, and maybe needs to be evaluated further. People that have free PSAs over 10%, typically that's not conclusive enough information for me to say, oh, you're done, everything's fine, don't worry about it. I think that approach was used 5, 10, 15 years ago to try and avoid doing biopsies. But I'm not really aware of anyone advocating free PSA in this modern era as a way to avoid doing biopsies.
Hey everyone, it's me, Alex, and our mascot Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high-fives me, high five, can you high-five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks that's awesome. Also, don't forget to visit our website, PCRI.org.